Hi, my name is Marcia Woolard, and I'll be presenting a case study, Professionalism in Nursing. There are many professions and disciplines in which the professionalism is the utmost importance, and nursing is among them. Within the field of nursing, there is much value to be placed with the enhancement of professionalism within the profession. Nursing is a profession that relies on practitioners to act in a way that represents the virtuousness of the broader discipline, as all nurses are in a position of responsibility. Professionalism in nursing means different things to different people. For some, define professionalism as nurses' knowledge, skill set, and how care is delivered to patients. Others view professionalism as a continuous journey to improve nursing practices, the workplace, and nursing future. There's always going to be ethical dilemmas that are encountered by nurses across the continuum of care at all levels of practice. Professional nursing practice is a commitment to compassion, caring, and strong ethical values, continuous development of self and others, accountability and responsibility for insightful practice, demonstrating a spirit of collaboration and flexibility. The following case study will further examine the topic of professionalism in nursing, and from this will clear that professionalism among nurses is of utmost importance. I will first present the details of this case. Diane McIntosh is a nurse who is single, has no children, and has 2 years of experience as a staff nurse on a general medical floor that serves many diabetics and stroke patients. She also is a team leader that gives out direct patient care and plans basic care for other nursing personnel to carry out. She works a lot of time on her days off. She works with the team and helps with hospital procedures. She hopes this will lead to better care to a larger number of clients in the future. She does have a history of working extra hours at home and at the hospital library writing those procedures. She has a co-worker who is also a nurse. Her name's Arlene Estes. She's a single parent with 3 children, and she doesn't have a lot of time to come in and to get the extra education and work alongside others to learn and benefit from that education. She complains to the other co-workers about Diane, saying she is foolish to work without pay. Also, Arlene's quarrel is Diane looks as though working without pay is like functioning as a super nurse. So this is how Arlene views Diane, as functioning without pay. She's feeling as though she's doing above and beyond. So she puts the other nurses in not having as much responsibility. So she's saying that this puts the other nurses in a bad light. Not everyone can work overtime for much less free time. There's children and family that take a lot out of the time of each day. So Diane doesn't have these issues, but everybody else more or less does. Everybody within that ward, that floor, has a lot of responsibilities, and so Diane doesn't. So then she has that free time to do those things. So the nurses are upset. They believe that it's unfair to them. It looks like Diane has more responsibilities. It makes it look like she's above them. Okay, so in addition, Diane's working without pay increases the expectation that is put on the other nurses, like they're not doing their fair share. So it's making them look like they're not doing as well. It feels fair to those other nurses that are paid an hourly wage. Working overtime without pay, Arlene argues it is the same amount as being paid less than a one contract provides, and which is unfair. Arlene's quarrel as Diane looks as though working without pay is like functioning as a super nurse. We got to think about that. Why does Arlene feel that way? It's unethical that she feels like that. She's putting a negative atmosphere there for Diane. Arlene finishes defending her position by arguing that nurses like Diane actually hold nurses down by contributing to exploitation rather than helping to raise nursing to the status of profession, because professionals like physicians and lawyers get paid well for their professional work, and she feels nurses should get paid the same. Well, not exactly the same as a nurse or as a doctor or a physician, but nurses are professionals, and they should be paid accordingly and not free pay. So despite her justification for working extra hours, Diane nevertheless feels hurt by other nurses' reactions, especially those of her friend Arlene, whose skills and integrity she's always admired. The reason Diane works for free, Diane will gain a lot of positive reinforcement from being with a group of people that she thinks that from that experience she will gain a whole broader picture to add to her education. With all her education that she wants to share with going forward in her nursing career, that she'll have all that to bring to the table, which would make it better for the staff, patients. Everybody will appreciate everything that she put into her hard work now going forward. The moral dilemma of this is there are other nurse co-workers that feel like the relationships are strained with those nursing co-workers. According to Diane, these nurses, they think she's crazy coming in on her own time. Diane goes in practically every morning, and on her days off, she's fully committed to wanting to learn more and be a better nurse, to do as much as she can. Diane also faces this moral dilemma. She wants to show her other co-workers that nursing is an important profession, that nurses have more to contribute than passing meds and giving baths. So there's more to this that she feels, and she feels like going in and trying to get all the education and having those meetings will broaden her career, that she'll be able to share that. Diane works without pay to attend weekly meetings to be a part of a team composed of professionals and physical therapists, occupational therapy, and social services, who are all active in rehab. All those get paid, and they're basically professionals just the same. So there's an issue there. According to Kant on moral worth, Kant has something to say about what makes someone a good person. Keep in mind that Kant intends to go along with the rest of his theory, of course, that one's duty is determined by the categorical impairment. A person's actions determine her moral worth, but there is more to this than merely just seeing if the actions are right or wrong. According to Kant, a good person is someone who always does their duty because it's their duty. Diane works without pay to attend weekly meetings to be a part of those teams. Those teams are composed of professionals from physical therapy, occupational therapy, social services, who all are active in rehab. And what I said, they get paid. But she's still a part of them. She's gaining education. She's learning from them. Even though she's not getting paid there, later on down the line, she can add this to her resume. And also, this education she can bring to the table to help her staff, her patients, her nursing care. It's all a part of education and learning. The overall theme is to be a good person, you must be good for goodness sake. Diane comes on her day off to work alongside of these teams. Her hope is to learn to give a better care for a larger number of clients. Utilitarianism, I always chop this word up, as an ethical theory that places the focus of right and wrong solely on the outcome of consequences of choosing one action policy over actions in other policies, moves beyond the scope of one's own interest and takes into account the interest of others. The goal of utilitarianism is to maximize happiness for the greater number of people. The reason Diane works for free is what she gains. She gets a lot of positive reinforcement from being with the group of people. She thinks she'll have a better impression of professionalism in nursing because of that participation. She defends herself by illustrating coming in on her days off will involve her with those teams at one point or another. Working on hospital procedures is, of course, education. Will lead to better care for a larger number of clients, which will lead to the greatest number of people appreciating the nursing care she'll provide. Professionalism in nursing field are those nurses. Professionals in the nursing field are those nurses that understand that their discipline extends beyond the individual. And it is the collection of nurses throughout the nursing community that create the industry. Nurses need to understand that they are a team and they must work together as a team. Professional nursing practice is a commitment to compassion, caring, and strong ethical values. Continuous development to self and others. Accountability and responsibility for insightful practice, demonstrating a spirit of collaboration and flexibility. Nurses need to work to educate others about the role of nursing within the healthcare sector, as well as lead by example. Nursing professionalism requires those who work within the industry are leaders, and this facilitates the passage of professional tendencies from older and more experienced nurses to newer nurses. Overall, nurses need to conduct themselves in a way that is good for the profession, a way that reflects well on all nurses, not just the individual. This works to give nurses and nursing the reputation of professionalism, and further serves to benefit the profession. A nurse also needs to continually improve, just like Diane, working without pay, wanting to be a part of the team for the greater good. She's getting education. She will be able to grow from that. Becoming an excellent service provider means continually learning from the experiences you have and building on them to provide quality care in the future. A nurse who needs to look within themselves to determine if they are treating others with respect that they deserve. It's important to understand that nursing is a team game, and all the members of the team rely on each other. In conclusion, while nurses have a role to play in creating professionalism, there are some barriers that stand in the way. One of the major barriers is a difference in educational background among nurses. Different nurses have different levels of education. This can serve to divide, but nurses ought to work to maximize the effects of educational disparity among them. And there are barriers to professionalism in the nursing industry, but they can be overcome if nurses work together toward a common goal, not talking down co-workers who are trying to help everyone. Ethical values are essential for all healthcare workers. Ethical practice is a foundation for nurses who deal with ethical issues daily. Thank you.